And a lot of the speakers touched upon the patients who are subject matter experts, which is what we like to call them, because we as patients are really the experts in sickle cell disease. We know all the parameters and levels and challenges that we have. And also the providers that were on your panel earlier. I was listening to all the wonderful information that they were giving, and everyone touched on a lot of important points. So I'm just going to really share an overview that really encapsulates kind of all the thoughts that were just said and give a perspective on an approach. Having been through all of this myself, I will share some of the experiences that I've had. So with this group, we all are aware of what sickle cell disease is. It's a complex chronic illness. And what I want to bring to mind is that it's a combination of support from family, patients, families, providers, support networks, and health systems. It's also a part to play by the community-based organization and advocacy groups, which is one of the ones that's putting this on, and they are vital in the process. Federal agencies, private industries, and political representatives and innovators. This, the work does not fall into one person's hands by any means. When you think about the comprehensive care program, which we think of as we reference as kind of the ideal way to treat a patient, what we'd like to see ideally is in comprehensive care is an accessible, well-coordinated, and evidence-based protocol, which many people have referred to. And it's made up of a lot of components, some of which I've listed here. But we're highlighting today mental health support. Now I list them: the integrated behavioral health, the psychosocial health system, support for academic and vocational goals, integrative health component, and community-based component, advocates and champions. And what one of the presenters said earlier, which is extremely important, is that mental health and your physical health are just as important. All these components weigh in equally, but a lot of times the attention is not given equally to all. And what we have been doing in the conversation and in what has been going on today and in the most recent year or 2 years, 3 years, is to bring some of those things to light and to the surface. And there have been some landmark studies starting, I can go as far back as 2007, that we have started documenting these things and showing the validity of them so that they can get the proper treatment, which we can all agree on this panel. I don't think it's lost on this panel that it needs to be improved. It needs to be increased. It needs to be augmented. So that in the interest of time, I'm going to make sure that I kind of encapsulate this and keep it going. And of course, as we have our discussion afterwards, we can talk about it a little bit more. So what some of the research has shown is that there are some common mental health challenges that our community as a whole suffers from. And when you do the studies and compare us to the national average, we suffer from some of these syndromes at a higher rate. And I will say that what's even more impressive, and when you think about this paradigm, is that many times we suffer from these issues at the same time, concomitantly, so that they need to be addressed because they become long-term and they also build up on themselves. So depressive syndrome, which some people have expressed and referenced today. Social isolation. I think there is a part of our disease process that we all suffer in isolation, but we also remove ourselves from society. And then within what is going on right now with COVID-19, that has put another layer of isolation on top of us. Feelings of helplessness, and I would say helplessness and also hopelessness, they're two different. Suicidality, anxiety, psychosis, and PTSD. PTSD, as you know, when you think of our disease process as a traumatic event, has really taken a whole different form when you talk to our community and connect with patients and hear their stories, because we carry that trauma from one episode to another, and it affects our psyche. It affects how we approach the next crisis. It affects us just in life in general, because it becomes this trigger and this weight that sometimes we deal with alone in isolation, but it adds actually to the level of pain and the syndrome when we have a sickle cell crisis. And studies have shown that individuals that suffer from these and carry these, and sometimes not even aware of them, have more acute sickle cell crises when we present in the emergency room, and sometimes misdiagnosed. because we're suffering from one thing, but only the physical is addressed. And that puts us all at a disadvantage because it's a total picture. When you think about the depressive syndrome, we know that the weight of this disease process, not necessarily having an answer, or even the thoughts that we are programmed with by others at the beginning, become a weight because it's not necessarily a problem that we can solve quickly. There's no immediate answer. So the weight that we carry really affects and changes our mood along the way that it's not always picked up on. Now, what are some of the common causes when we talk about these different mental states and these different stressors that we carry concomitantly? I will say that in the research, depression and anxiety were two of the ones that came to the top of the list. Anxiety because of the issues, again, that people on the panel have already referenced, of how we feel with the fear of losing control, the fear of not knowing what this particular crisis will be, the not knowing in whether the therapy we're taking will be immediately effective. There are so many unknowns when we go into a crisis, though there are so many parts of the crisis that we've become so used to dealing and resilient in dealing, but there might be a more structured way in doing it. And again, some of the people on the panel have referenced that. So the pain crisis episode is a trigger and an essential part. The chronicity of the illness. So when we come out of the acute setting, which we've also referenced, there's a lot that we deal with on a day-to-day basis, not just the chronic pain, but the issues that are one on top of the other, what we call concomitant, that really shift and change our lives. I talked about the trauma. So a lot of right now, we have this mindset that we are finally looking at sickle cell disease as a traumatic event because it really shakes our lives to the core. And it leaves an imprint upon us, which no one is necessarily discussing. And we as individuals have to deal with by ourselves. And then on top of that, all the other issues that sickle cell disease brings. The unpredictability, which is in one sense very unique to this illness. We never know when this disease process will magnify and become, as they like to rate. Are you a 10 out of 10? And sometimes I ask people, what does that exactly mean? You mean, is my life being completely ruined and turned upside down right now? Yes, that's exactly where I am. So are you giving me tools in order to address that? And the disruption syndrome, I love that one of the panelists really went into that when she talked about her brother. This is also something that's somewhat unique to our process in that every crisis, whatever level we're at, knocks us down for some of us to almost a level of 0. And then we have to build ourselves back up to either the level that we were before or even better. That type of disruption out of life and not having our baseline that is usually kind of even for most people is another stressor that requires a whole set of tools to deal with that a lot of times we are not given. So can we shift to a patient-centered concept, right? We talk about comprehensive care, coordinated care, accessibility, and commitment to quality of care. The ideal way to deal with these issues is a biopsychosocial model. What I like to talk to my colleagues about, because I talk to a lot of physicians, but then a lot of people in the community, other patients like myself, is that we want to think and treat the patient first. What is the patient going through? What's their environment, their stressors, their cultural barriers, their emotional state, even down to their sleep patterns. And then, so that's the micro, right? The macro. And then think about the micro, which is the labs, the radiology, the medication, and all that. Unfortunately, the way the system has been structured for many years is that they look at the micro first and then the macro after. And I've always said, and I strongly believe that that's the wrong way. We should start with the macro. We are all human beings who are dealing with a set of very strenuous circumstances. So that I always tell colleagues and individuals that the physical health and the mental health are not mutually exclusive. We need to address them together. So can we shift from this patient-centered and comprehensive plan to a person focus? Can we think about the human being first? So the panel referenced very eloquently that we should get professionals to help us with some of these challenges. Sometimes part of it is it's not that we don't want it, but sometimes it's not even that easy to identify it because we've already gotten into this rhythm that this is just what we do to push through. these different components have not been identified for us, and it is unfair for us to just be expected to kind of know them. That is why we have care providers, right? That is why we have partners. So one approach that maybe we can have a little bit more control over, because there's an element of empowerment that needs to happen, is building what I call a wellness foundation. And there are 4 basic components to that: eat well, love more, move more, and stress less. Because what another person said on the panel is that as patients with the disease process, we also have to go out and ask for help. But the first part of that is actually realizing and being aware that we have the problem. So I think of giving the patients the tools that are a little bit more tangible. What can we teach the patients, and what skills can we give that they can stand on? And then the wraparound services can elevate and augment how well we do, meaning the individuals that give us care, if we go to a psychiatrist or psychologist and all that. But it all starts with us building ourselves. So I like to teach the fundamentals as 6 tenets: self-awareness, meditation, connection, nutrition, exercise, movement, and yoga. Some of this, again, was referenced in the conversation. But by doing all of these things and addressing them for ourselves, we then can improve our mental health and our physical status. Now, I know I don't have a lot of time, and I don't want to go over because I know there were a lot of questions. So I'm just going to just touch on each one just a little bit. I like to say what the science has proven. So all these points, all these pillars have scientific research that has shown and proven them to be very effective in dealing with chronic illnesses and helping with the mental state. So again, addressing the physical and the mental at the same time, because they both actually weigh equally on the patient and the challenges that they may have. So to start off, it's self-awareness, right? We're born with a sense of self. And sometimes we lose that when we start to define ourselves by external parameters. We always know what our true self is, right? And sickle cell disease is a disease of isolation. So that anything that promotes that isolation leads to chronic stress and often more acute illness. So can we approach that as a way of even helping our disease process? We want to achieve what we call horizontal intimacy and vertical intimacy. Intimacy with ourselves, and then intimacy with others. Because if we don't know ourselves, and if we're not well rooted and have that foundation, and not listening to how we've been programmed necessarily, it is then harder to have those vertical intimacy. But that intimacy can be very supportive. And sometimes my colleagues ask, the research shows that isolation increases mortality, increases illnesses. If we can create that connection between when we feel stress, right? What is making us feel the stress as we're going through it? That takes an awareness, making those notes, and then that stressor becomes the teacher. So even in learning our disease process for ourselves, for instance, what are my triggers? They're stressors. As I listen to myself and identify them, then I can approach them differently. And then that improves my mental state and my physical state overall. And pain is a catalyst. If anybody were to tell me this will reduce your pain by 50%, and it's not necessarily a pill, but I'm rebuilding myself from the inside and moving out, I would wholeheartedly do it. You don't have to tell me much more. So how do we approach self-awareness? Simply by it's not simple, but we want to find our joy. You want to find your purpose. That takes some self-exploration, right? Going within, looking at perspective, humility, humor, acceptance, forgiveness of self. Sometimes we have to forgive ourselves for what we're going through and not be too hard on ourselves. Have gratitude, compassion, and generosity. Laura, how am I doing on time?
Agnes is moderating, sorry.
Oh, sorry. Okay. I just don't want to go over. Agnes, how much time do I have? 5 minutes?
I think so. 5 minutes will be okay.
Okay. Meditation, I'll touch on in mindfulness. If we give ourselves a moment to quiet the chatter in our minds, we are going, in our disease process, one of the things is that our metabolic rate is working at a higher rate. We know this as one of the factors of sickle cell disease. Just like everyone else, our mind is also working at a higher rate. Sometimes we're already thinking as we're leaving one crisis, what's the next crisis going to be like? What do I have to do to rebuild myself? What responsibilities did I leave behind or got put on hold because I wasn't well? So many things are going on in our mind. But if we take a moment to actually be still, which is easier said than done, and breathe, our bodies can actually respond in a positive way. Not only will our heart rate be better, our respiratory rate will be better, but our bodies and ourselves, we connect, make that mind and body connection. And a lot of times the answers are within us. And we just have to kind of be able to have a moment to pay attention, because things can get so hectic and pain can be such an overriding factor that we do have to train. It's a matter of training ourselves to take a step back in order to be able to hear what our body is telling us that it needs, and supply it and give it and make those other connections and empaths and roads that we need. Having a good nutritional basis, which someone touched upon, and I will touch upon it again, is fundamental to just your health, your mental health, and your overall health. Movement can be such a wonderful, happy pill. Whatever that movement is for you, it might be walking, it might be dancing, it might be jumping on a trampoline, but there are medical benefits to it, as I've listed here, but also it helps to level our mood out. It actually gives us this positive sense that if we can have more areas in which we supply a positive response in our body, or remember things that generate a positive emotion, then that in itself can also help our mental state. Yoga, a place where the mind, the body, and the spirit meets on the mat. What I like to say is yoga helps me train myself for the hard moments when I have a sickle cell crisis. So when I challenge myself on the mat and I apply my breath work, my mindfulness, my visualization, my self-analysis, my progressive relaxation, when I'm in the midst of a crisis or stressed, I can easily tap into those skills because I've used them in a controlled environment, and they then help me get through my crisis. And I feel like that is something that is very teachable that our community can access whenever they need to. When I is replaced by we, even illness becomes wellness. And some of the moderators talked about support groups, but it's making real connections, creating a judgment-free and safe place so that I, as a patient, am comfortable enough to speak whatever's going on in my mind. And I know that the person on the other end is receptive and really listening. We all have different biases. So sometimes as a care provider, we're already listening, thinking we have the answer, but can we actually take 3 steps back and really plug in and listen to what the person on the other end is telling us, and then address it in real time? That's very different from just having a conversation. And I would say, which I've heard many people say, deep and rooted connections, spiritual connections, connections with family, and it only takes 1 or 2 people to be really connected with, can sometimes be the bridge that carries you from moment to moment and helps you feel better. So in opening our hearts to wellness fundamentals, you'll be giving individuals with sickle cell disease the tools to living their best life. That's what I like to share with care providers. That's what I like to share with my colleagues. That's what I like to share with the community, because we as individuals that have this disease process are very resilient. There are ways to rebuild ourselves from the inside up and then use those tools to improve our health, mental health and physical, that are just as equally as important. So thank you so much for your time, and I'll stop sharing right now. I hope that I went according to the time frame, and my apologies if I went a little early over.
You did, Dr. Dejoie-Brewer. I'm always intrigued in your presentation, and I apologize for coming in late. I got the link late, but I'm here. I'm Agnes Insofa from Australian Sickle Cell Advocacy, and I'm so excited, glad to be here. Thank you so much for that presentation. I'll just check if you've got any questions in the chat box. No questions yet, but I know we have testimonies from two warriors on this panel. Before I give the floor to Mimi and who's the other one representing the patients, Laura?
The first patient will be Jenica, please.
Jenica. Okay. Before I do that, Dr. Brewer, you know, you've talked about, you know, anxiety and PTSD and depression and being self-aware, like self-awareness. I know it's very easily, you know, you can read, but in terms of practice, how do sickle cell warriors practice that? Because it's very difficult to train the mind to know that, you know, at any time a crisis is coming, and how do you just meditate and be able to carry on to practice that so that you don't go into depression or always anxious, and after the effects you go into, you know, having PTSD?
Absolutely. That's a great question. Thank you for asking it, Agnes. And it's not easy. It's not something that's going to happen overnight. And anxiety is up there, and it actually increases our sensitivity to the pain that we're feeling. So it actually can augment the level of whatever we're going through when we're going through the sickle cell crisis. So what I tell people is to take it slow, 5 minutes a day. I personally love to start my day off with it at the beginning of the day, because it gives me a moment to just take a pause. Take 5 minutes to do something that is very comforting. Sometimes I just focus on my breath, because breathing by itself is actually a healing tool. I mean, a lot of times when we go into the hospital, they give us an incestus parameter, right? I think I have 10 in my drawer. And as a patient, as a physician, I'm like, if I can just learn, and it's interesting that when we think back, were we ever thought to breathe that properly? There's just an assumption that everyone, this is not just us, but just everyone in society would know how to breathe. So if we just focus on even proper breathing for 5 minutes in the morning, that gives us the time for ourselves. It's almost just carving out a couple of minutes. For some people, it might be prayer. For some people, it's breathing. But you want a moment that you can actually, as I was saying, kind of just take a moment to be still. Because what I've learned is then when I'm in the ER or in the hospital, I go right into my breathing mode, which brings me down 5 levels. You know that sometimes we're just ready to look at the person that's across from us and we want to just reach out and touch someone, and not in a good way. But this helps me to kind of dial it back. For some people, it might be music. So I encourage people to do something that makes you feel good, something that puts a smile on your face, and try to do it for about 5 minutes a day. And then as you take that time out, you slowly but surely build upon it. A focused breath exercise is one of the easiest ones. And one of the ones I teach is kind of the 4 count breath. And I like using breathing because patients in our community, individuals in our community can identify with, this breathing really helps me. I'm getting more oxygen in, I'm lowering my blood pressure, I'm calming myself down, and my heart is not beating as fast. And in a sense, that might be helping my anxiety. I would say that journaling is also a wonderful way to start. Thinking of moments, this is a good one, that made you happy. Last party that you went to, the last time you saw someone you loved, because the emotions that are attached to that event, you can, when you think of it again, you go right back to that place. You'll start smiling if there was something funny. Or if I say, did you see that movie and you remember that scene? It might be 5 years after, but we can all start laughing about it. So our body is already trained. It has that reflexive reaction. And when we're dealing with a crisis, it's all about leveraging the better emotions or the good things in our life to get through those bad parts in our life. So those would be some tips that I would give.
Very, very good coping mechanisms there.
Yes.
So I think right now, let's go to the sickle cell warriors and let them just tell us their experiences and whether some of those coping mechanisms have really worked for them. So Jenica, do you want to share with us what sort of things, the challenges have you gone through in terms of managing your mental health and living physically sickle cell disease?
Thank you, Agnes. Yeah, actually, as a kid, I used to have lots of crises, and to be in pain and not to understand why and how to deal with it. It's only when I turned about 20 that I realized that it was a whole thing. It was not only the pain and then not only the crisis and then the complication, how do you say that? The depression. It was, I had to take care of my body, my mind, and my soul. And when I realized that when I was feeling kind of depressed, I was having more crisis, I decided to start going to therapy with a psychiatrist. No, not psychology. I went to see a psychiatrist. How do you say that in English? Sorry, I can't find the word.
You're right, psychiatrist.
Yeah, you're right. Yes, psychiatrist. Yeah.
Thank you. And I decided that I had to start a therapy because I was mixing everything up. The crises that I was having were not due to a bad level of hemoglobin. I was having basically crises because I was feeling sad, or because I was anxious, or because I had, all these bad feelings, and it took me a long time to realize it. My mom used to tell me, you should go and see a shrink. I was like, no, you don't know anything about that. Leave me alone. You don't have sickle cell disease. But I'm not going to say that everybody went through the same thing, but I feel like at some moment I could say that sickle cell disease was some kind of pretext for not being good. So I decided that I should take care of my body and my soul, go see a psychiatrist, start doing sport, go back to studies, going out with my friends, and realizing that I had limit, but still I could do a lot of things. So when I decided that I had sickle cell disease, that it was going to have a big impact in my life, but still I could keep on doing a lot of things. This is when I started feeling better and having less crisis. Unfortunately, now I'm in hospital, but it happens sometimes. It's not a big deal. Yeah. So
thanks so much for sharing, Janabi. I will go to Mimi, and we'll ask Laura how we're doing with time, and then maybe you can come back and share some more. So Mimi, can you also relate to Janabi's experiences?
Thank you, Agnes, for giving me the speak. I'm sorry, I lose my mom 2 weeks ago, and we bury her last week. So I write what I have to speak about, because
I'm so sorry
about
to hear
that.
We understand.
We understand.
So I'm Mimi, means here me Maboloko. I'm 48 years, and I'm a sickle cell disease patient. I'm the vice president of ESCF and founder of Collective d'Entrepreneurscitos as BL Belgium. A few years ago, despite the ups and downs due to sickle cell, I was motivated and committed to fight against this disease, to be a sickle cell patient advocate. I had so many plans for a happy and fulfilling life. Professional project, anything a woman can dream of. However, I can no longer project myself. I feel like I lose control. The warrior that I was is physically and mentally tired from taking too many hits. Every time I was knocked out by sickle cell, I got up and still standing. I have worked hard for my health, for my studies, to integrate into society, to be in a relationship, and to achieve life goals. I believed in it, but now I feel like sickle cell and its repercussions destroyed my dreams little by little. Between Congo and Belgium, I developed almost all the symptoms of sickle cell disease. In Congo, life is a nightmare for sickle cell patients. There is no access to good medicine. Patients are victims of discrimination and rejection, even by their own families. People denied sickle cell. There are so many prejudices, taboo, and judgments, like a child is destined to early death. It makes you feel lonely and insecure. I left Congo to save my life. I think I would be dead otherwise. My father gave me not only an education, but also a solid mental strength. With my Bachelor of Law degree and my desire to help others people like me, I have been involved since 9 years, working diligently to spread sickle cell awareness through public speaking, engagement, and advocacy. But now I feel like I couldn't stand all that pain. Sickle cell disease is taking over all my dreams. 5 years ago, I found a man who sincerely loved me, but her mother didn't want me because of sickle cell disease and racism. I couldn't stand this new breakup. I had 3 strokes. As it was not enough, I have lost my parents successfully in the 3 last years. Yes, a child with sickle cells can bury his parents. What hurts me the most is that I couldn't give back everything my parents did for me, or nor my parents make them proud. All this shock would have plunged many people into a deep depression. In my misfortune, I am surrounded by a handful of people who support me and are present. They watch over me and are even sometimes more afraid for me than myself. Thanks to them, I have been able to hold on during these hard times. Also, to treat strokes, I have been on blood transfusion exchange for over a year. This new treatment really boosts me. I have gained weight and I have more endurance. I'm so thankful because I cannot support pain no more. Because of sickle cell, I spent the half of my life in hospital. This makes me more and more anxious. I'm lucky to have a good medication follow-up by a lot of specialists. Psychological support was offered to me in order to be helped by a professional. I think it's important to see a specialist, but many persons deny that fact. Against all, faith helps me to hold on, even if sometimes it's difficult. Sickle cell has given me times of excruciating physical and mental pain, but I think I'm one of those who are made to never give up and called to share my story. I would like to thank all the people who support and encourage me. The ESCF team, and especially you, Laura, who always has a kind, affectionate words. Agate from Italy, and all the others, I'm happy to have met you on my way. Thank you very much for your attention.
Oh, Mimi, thank you so much for sharing, and I'm so sorry to hear that. I'm so sorry to hear that. Dr. Dejoie, can I just bring you in here just to give Mimi some comfort
Mimi,
message?
I have walked in your path. I have had strokes also. I'm on exchange. I know the challenges. We share them. You are an example of exactly what I was talking about. You've still found your joy. You are resilient. Your parents are smiling on you because I've only just met you and I think you are phenomenal. I'm sending you that connection that you talked about, how thank goodness you have people around you. And we here as a community want to let you know that we are here for you to stand on our shoulders, because every once in a while, as warriors, maybe more times than others, we need to be held and supported also. If I were there, I would be wrapping my arms around you right now. But know
All
that
be
we all
wrapping
would.
around, yeah.
Yes. But the
Yeah.
fact that you did not give up on us and you still took the time to come and share part of your journey and a piece of you with us. My heart is just super happy to meet you, but also giving you and sending you the love and support you need right now. Stay strong. We are here for you and with you, okay?
Yeah.
But Agnes, she and the other speaker are exactly what I was talking about. They've connected with other people. They found a professional when needed. They have some type of a support system. They're finding their joy, and they learn about their illness and done things in becoming self-aware. I like when the other person said that she realizes that some days I'm going to have a limit, and that's okay. We're allowed. And in knowing that, that's part of the self-awareness. I'm sorry, I did not mean to cut off the other young lady who was about to speak. I just wanted to make
that's okay.
connection.
Janabi, you had your hand raised. Did you want to say something? Mimi, just quickly, you know, I'm just thankful that you had the courage to actually even share this with the world.
Yes.
And I feel like, you know, I'm giving you a virtual hug right now.
Yes.
Hear what you've gone through, and here you are to spread awareness and just to give love to others. I concur to everything that Dr. Brewer said. We just want to hug you right now.
Yes.
Janabi,
yes.
you had something to say. Did you
And
want to add on
I
something?
think.
Yeah. First things, Mimi, I'm so sorry for what you're going through, but you're gonna be okay. I know it's hard right now, but you're gonna be okay. There's just something I'd like to say quickly about this word we use a lot, warrior. We're all warriors. We fight against the disease and we are strong. I think it's good. It's good. It's important to be positive and to say that even though we have sickle cell disease, we are still fighting and we are not giving up. But I think that sometimes we don't really use it in a good way, because, for example, I have sickle cell disease. I start to live I try to live a normal life, but it's okay if we are not warriors every day. It's okay if sometimes we are just exhausted and we want to stay home and cry. And I mean, it is okay. We don't have to be warrior every day. I think it is important because everybody wants to be strong and show that everything is perfect, but sometimes it's not. So it is okay if sometimes we are just tired.
It's okay to show your vulnerability sometimes.
Yes.
So, and you know, yeah, sorry, go ahead, Dr. Dejoie.
No, I just wanted to say, I think that's, Danavi, I think that's so spot on. It's very, very true. But I would actually add a component that is actually the warrior who's always aware of when they need to take a break and take their crown off. So I do think, I will challenge you just a little bit. I do think that that is the right word, because it is difficult to be vulnerable. It is difficult to let people see that this is who I am. And right now, what's best for me is to be able to take a pause, is to be not seen, because I just need to catch my breath for a minute. So I think in that sense, we still are, and we are allowed to put that crown and put the spear down every once in a while, because that spear gets very, very heavy. Yeah, but on those days, it doesn't mean that we're not still warriors. But I totally hear what you're saying.
Yeah. Okay. Thanks.
Yeah.
Well, Agate, sorry if I'm mispronouncing your name. You wanted to say something as well. Please go ahead.
My English is not very well, like you see before. I just want to hug a lot Mimi, because she's my hero. I tell her all day. I'm a sickle cell too, but the moods she live is an example for me. Is an example to be able to live and to go through this life, and to have the strength she has. And I just want to thank Mimi for as in my life. Like I said, she's my superhero.
Thank you.
That's awesome.
Thank you.
Agnes, I love that somebody put in the box that in the chat that they say that they prefer to maximize the condition as opposed to use the word warrior. I mean, at the end of the day, we're just human beings trying to make the best of every day that we have here on earth, whatever the best is. And I also actually don't like to use the word normal. What does normal mean? Sometimes we outdo the other people that think they're normal. I'm just saying, as we like to say here in the States. And actually,
right.
I have a French background. My family's from Haiti, so I could talk to you guys in French all day long. But we just want to live our best life. That's it. And on certain days, my best life is the TV, a foreign film, and the sofa. And please don't talk to me. And that's okay. That's okay. I know that my community is still here for me. So that's all that matters. Yes.
You're right.
Thank you so much. Consi, is it Consi? Did you want to say something?
No, not really. I'm just kind of intrigued of everything that has been said. And also I love what, thank you very much, Mimi, for sharing. I know what you're going through because I've been there as well. And also, Jenna, we are warrior, whether we want to believe it or not, we are warrior. But we are not we are warrior in mind, in spirit, and in soul.
Amen.
Because what we go through, not everybody can do it. Yeah. That's all.
All right.
So we are now in the question and answer session. If there are any questions in the chat for Dr. Brewer or for any of the patients that spoke or in the Hover app, we'll be dealing with them now. Thank you for both panels. Thank you.
Thank you, Laura, and thank you, Dr. Joy. Could I be excused because I'm getting these phone calls, and I'm sorry that I have to leave a bit early. Is that okay, Laura?
That's okay. That's okay. So I will just read out a question. Thank you so much, Agnes.
Thank you, Agnes. We'll connect by email.
We will connect. We will connect. Thank you so much, everyone. And Mimi, my love to you again. I'll find you. I'll stalk you. I'll find you online. We'll talk.
Thank you. Thank you so much.
Thank you so much, everyone.
Thank you for taking on this role. Thank you so much. So it looks like Agnes is leaving me on my own to moderate this Q&A then. So I will just read in the chat here to see if anybody wants to say something. And before we can, if anybody on the panel here wants to say something, I just will recognize we have Dr. Corina McMahon here. Unfortunately, I don't think she would be able to speak. It would have been great to hear from her say something on this topic. I just want to ask David Isom. David, if you're able to say something in relation to this topic, depression and anxiety, please.
Yeah, well, yeah, I can try, but it's difficult to add on what has been said. But however, I can emphasize on the importance of the how to say, the first stage in disease acceptation, which I mean that before indeed we can become the best person we could be, we need first of all to accept the disease, and starting from that process, which is not easy for anything like that, then we can indeed become more and more empowered. Learn, for instance, what are the things that will decrease our quality of life, what we can do to do that, like people talked before about distractions, for instance. There are many things we can do, but first of all, I think the process is the acceptation, and that's where also all of us patients, but also healthcare providers and carers can support by accepting us also, and helping us accepting ourselves as we are, because we are, as has been said, also humans with different characteristics. So I think the human part is the most important.